At Boise State Public Radio, you can listen to all of our podcasts free of charge. We don't lock any episodes. We don't require subscriptions, nothing like that. But the truth is, although our podcasts are free to listen to, they're not cheap to make. A lot of time and resources go into bringing you the daily news on The Connector, statewide voices on Idaho Matters, and the long-form journalism in podcasts like Scandalized, Extremely American, and Mustang. That's why we're asking, if you can, please consider supporting Boise State Public Radio podcasts today. We have a lot of work planned for 2025. Yes, new podcasts, but none of it would be possible without the generous support of our listeners. Every gift matters, whether it's $5 or $50, whatever feels right to you. Head to our website, boisestatepublicradio.org, and click that blue donate button. If you're giving to support podcasts like the one you just hit play on, leave us a comment with your donation and let us know. Your support will help make sure these podcasts keep coming and remain free and accessible to everyone. Thanks so much for listening.
More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudette. Over the last few years, more information is coming out about the long-term health risks of wildland firefighting. And now a new paper published in the Journal of Occupational and Environmental Hygiene is detailing a troubling picture when it comes to carcinogen exposure to these firefighters. The Mountain West News Bureau's Murphy Woodhouse has been following these developments very closely, and he's joining us now to talk more. Hi, Murphy.
Hey there, Gemma.
So, Murphy, researchers studied more than 4 dozen papers that looked at exposure to various carcinogens on the fire line. So what did they find in these papers?
Well, they found carcinogens, a lot of them, 31 to be specific. And I want to be clear that this is not an exhaustive list. It is simply what this review turned up in a pretty methodical analysis of existing scholarship. And the authors make clear that a lot more research is needed on many fronts here. So what kind of carcinogens are we talking about here? Particulate matter pollution was the most widely studied among the papers analyzed. And that comes from things like inhaling smoke and dust and ash on the fire line during activities like initial attack or fire line construction and mop-up. But they also found polycyclic aromatic compounds like benzopyrene, volatile organic compounds like formaldehyde, and asbestos. So for the story, I spoke with one of the co-authors, Kat DeBose, who's just really been a wonderful source to me on the firefighting cancer connection. She's now the head of environmental and occupational health at the still fairly new Federal Firefighter Health and Wellbeing Program. But she's also done a full season on an elite federal hotshot crew and has done some of the most important research on long-term health risks for wildland firefighters. And what she told me about the findings is that they are very much in line with the World Health Organization's International Agency for Research on Cancer's 2022 determination that the occupational exposure firefighters experience to carcinogens, or rather their occupational exposure is carcinogenic to humans. So that finding from 2022 again was for firefighting in general, not any specific subdiscipline. But Kat told me that the body considered wildfire-specific studies in its evaluation, and now we have this figure of 31 carcinogens, which again should be understood as a baseline for wildland folks.
So, Murphy, only a few of these papers, though, that were analyzed found concentrations of carcinogens above official occupational exposure limits, and these limits have been set by federal regulators. So does that mean there's minimal risk to firefighters?
So that's an absolutely key question, and Kat's answer is pretty clear. No. She says that doesn't mean there isn't risk, but let's hear a little bit from her about why that's the case.
We are seeing these unique exposures in the wildfire environment, and we really don't understand or know yet what they mean from a cumulative exposure standpoint. So that's still where we need to really understand these exposures in context.
Yeah, so a little bit more about that context. As the paper notes, Wildfire is a uniquely arduous profession. We're talking long shifts, high exertion, and thus higher respiration and elevated exposure. But then also, given the high number of different carcinogens, there's also the question of the potential risk of overlapping exposures or synergistic effects between multiple exposures. And Kat says that a key question moving forward will be setting wildland specific exposure limits given some of these unique aspects of the work. But as to what can kind of be done more immediately, I mean, we're talking about real risks now, known carcinogen exposures now. The paper talks about things like regularly rotating crews out of heavy smoke areas and locating incident command posts in places with lower exposures. But I really do think it's worth saying that many of these dangers may be unavoidable to some degree, just kind of given the nature of the work. I mean, we were talking about fire, which necessarily gives off smoke, and I think that a lot of this does raise profound questions about the nature of wildland fire and the sacrifices that we are asking from people out in the woods every single summer.
So, Murphy, you've done reporting in the past in regards to how back in 2022, Congress eased access for wildland firefighters to get workers' comp. This is in particular when it comes to certain diseases like cancer. So can you quickly refresh our memories on this?
Yeah, absolutely. This was just a really, really big deal. So that the reform you just mentioned, that was a part of the 2022 National Defense Authorization Act. And what it did was declare that certain diseases, and there's like a literal list you can go and look at, certain diseases like testicular, prostate, and prostate cancer, leukemia, a number of other cancers would be presumed to be work-related for federal firefighters. And so that was kind of in response to long-standing issues with the workers' compensation process for folks with serious chronic illnesses. And that was just a major concern for firefighters and their advocates. And this change was certainly celebrated as a major win for firefighters.
So, Murphy, you mentioned these cancers. There are advocates, though, who say that this just doesn't go far enough, and they really want broader and more inclusive coverage of cancers that specifically impact women. So tell us about this.
Yeah, absolutely. So what many, especially women in fire, didn't see in this list was were things like breast, ovarian, and uterine cancers. So earlier this year, groups like Grassland, Wildland Firefighters, and others they sent a letter to the Department of Labor asking for the list of presumptive conditions to be expanded to include cancers that largely or exclusively affect women. So wildfire is, I think it's unsurprising to many, a deeply male-dominated profession, but women are still 16% of the federal firefighting force, and federal agencies furthermore are trying to address these yawning gender and racial gaps in the workforce and expanding presumptive coverage to such cancers. That was actually one of the recommendations made by a recent paper making proposals about how to address the equity picture, especially for gender equity.
So, Murphy, how has the U.S. Department of Labor responded to these advocates?
Yeah, so the agency told The Guardian in response to the reporting on this letter that there was no new research to support such an expansion, but that it is continuing to monitor scholarship. And so, unsurprisingly, this was disappointing response to advocates. But I think that Reva Duncan, who's with Grassroots, one of the signatory organizations, I think she has a thoughtful comment on the complex relationship that they have with that agency.
They've been really great to work with, and we've made a lot of gains with them. We definitely want to celebrate how far we've come, but we don't want to leave anybody behind, and we feel like this leaves women behind.
So, what I can say about, where things might go from here is I am certainly aware of some research looking into exactly these issues, specifically cancers that affect women. So I will certainly be keeping a close eye on this situation.
Murphy, I've got 2 minutes left with you, and I want to get to another report that you just did. And this is on a major study that is established. I mean, this is, I think, concerning, Murphy, a really strong link between wildfire smoke and dementia. Talk to us about this and what our listeners should know.
Yeah, so this one is frankly pretty troubling. And so just a little background on the research. So for it, they were looking at the electronic medical records of some 1.2 million patients in Southern California. And what they were principally looking at was what's called PM 2.5 pollution, which is just very small, breathable particles in the air, many, many times smaller than the width of a human hair. And so what they found is that pollution in general, kind of not considering the source, is associated with an increased risk of a dementia diagnosis. But what they found was that PM 2.5 from wildfire smoke specifically is much more potent. So this is going to get a little technical for a second, but I think it's worth noting. What they were looking at was average concentrations in the air over 3-year periods. And so for every additional, I think it was micrograms per like meters cubed or something like that, for every additional unit, there was a 1% increase in the risk of a dementia diagnosis for PM 2.5 in general, but for wildfire PM 2.5, an 18% jump. And so this is obviously very troubling. But I do think that, like, you know, when you report on things like this, there can be the response like, well, let's just put out all the fires, right? Let's get rid of the smoke. Let's get rid of the exposure. But people really need to get it out of their heads that there is a depression first way out of the wildfire crisis and all its attendant problems like this. No smoke is simply not an option, and heavy suppression is in fact one of the key factors, along with climate change, that has made wildfires today so destructive. So what we get to decide is the smoke what we get to decide between is the smoke we choose, things like prescribed fire, cultural burning, lower intensity portions of wildfires, and the smoke that comes unbidden from out of control wildfire. And so as studies that I've reported on previously show, in the long run, prescribed fire and other low and medium intensity fires can reduce smoke exposure. But yeah, fire and smoke and the smoke it creates, these are unavoidable and essential parts of life in the West.
Well, as always, Murphy, really appreciate all of your reporting on this. We've been speaking with the Mountain West News Bureau's Murphy Woodhouse about his recent reporting in regards to wildland fires and the firefighters, and their exposure to carcinogens and other research information. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho Voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.